presented by Dr. Kalyan Varma, Professor, Forensic Medicine and Toxicology. Welcome to this educational video on cardiac poisons. Using the mnemonic DNA of Queen Cinderella, we will explore 6 major cardiac poisons, their effects, and the management of poisoning. Digitalis, also known as Digitalis purpurea. Known as foxglove, this plant is toxic in its entirety, but its leaves are used medicinally. The active principles include cardiac glycosides such as digitoxin, gitalin, and gitoxin. Digoxin, found in Digitalis lanata, is currently used in medicine. The mechanism of action involves acting on heart muscles, prolonging the diastolic period. The symptoms and signs include gastrointestinal, nausea, vomiting, anorexia, abdominal pain, and watery diarrhea. Cardiovascular dysrhythmias, especially ventricular fibrillation and extrasystoles, inverted P wave, and short QT interval. Visual, chromatopsia, photopsia, xanthopsia, photophobia, and dilated pupils. The fatal dose is digitoxin at 4 mg, digitalin at 15 to 25 mg, and digoxin at 5 to 10 mg. Management and treatment involve multiple dose activated charcoal, cholestyramine, and cholestyramine to prevent drug reabsorption, digoxin. Specific antibody fragments like Digifab or Digibind, antiarrhythmics such as lignocaine and phenytoin, atropine for bradycardia, and maintaining fluid and electrolyte balance. Autopsy features include the presence of digitalis leaves or seeds in the stomach. Medico-legal importance involves accidental poisoning from therapeutic overdose and the cumulative poison effect. Nicotine, derived from Nicotiana tabacum, prepared from the leaves of the tobacco plant, which contain the highest concentration of nicotine. The active principles are nicotine, nornicotine, nicotianine, and anabasine. The mechanism of action initially stimulates the vagus nerve, then depresses the autonomic nervous system and central nervous system. The symptoms and signs of acute poisoning include nausea, vomiting, abdominal pain, hypersalivation, headache, restlessness, meiosis, followed by mydriasis, tachycardia, followed by bradycardia, and respiratory failure. Chronic poisoning presents with vomiting, diarrhea, anorexia, angina, insomnia, anxiety, and lung carcinoma. The fatal dose is 50 to 100 mg of nicotine or 15 to 30 grams of crude tobacco. Management and treatment include gastric lavage with potassium permanganate, tannic acid, or warm water with charcoal, atropine sulfate, and hexamethonium chloride, mecamylamine as the specific antidote, and oxygen and artificial respiration. Autopsy features show asphyxial signs, brownish froth at the mouth and nostrils, and the presence of leaf fragments in the stomach. Medico-legal importance includes accidental poisoning common from drinking hookah water, and nicotine resists putrefaction, making it recoverable from viscera post-mortem. Aconite, from the Aconitum species. Known as methabish or monkshood, all parts are poisonous, especially the root. The active principles are aconitine, hyperconitine, and mesaconitine. The mechanism of action stimulates then paralyzes sensory nerves and depresses myocardium, smooth muscles, and skeletal muscles. Symptoms and signs include tingling and numbness, a burning sensation in the mouth, nausea, vomiting, muscle weakness, bradycardia, hypertension, and hippus, which is the alternate contraction and dilatation of pupils. The fatal dose is 1 gram of the root or 2 to 5 mg of aconitine. Management and treatment involve gastric lavage with milk or tannic acid, activated charcoal, atropine sulfate for bradycardia, magnesium sulfate for arrhythmias, and oxygen and artificial respiration. Autopsy features show asphyxial signs and congestion in all organs, with unstable aconitine destroyed by putrefaction. Medico-legal importance includes common occurrences in accidental, homicidal, and cattle poisoning, and its use as an abortifacient. Oleander, which includes both Nerium oleander and Cerbera thavatia, is known as white or yellow oleander. All parts of these plants are poisonous. The active principles include nerin, oleandrin, carabin, thavatin, and cerberine. These substances affect the heart, causing cardiac arrhythmias and, in severe cases, cardiac failure. The symptoms and signs of oleander poisoning are quite alarming. They include nausea, vomiting, abdominal pain, dilated pupils, muscle twitching, and even tetanic convulsions. The fatal dose can vary. It might be 5 to 15 leaves, 15 to 20 grams of powdered root, or 8 to 10 seeds in adults, and just 1 to 2 seeds in children. For management and treatment, gastric lavage is essential, followed by the administration of activated charcoal. Supportive care is also crucial, which includes maintaining fluid and electrolyte balance and providing oxygen. During an autopsy, one might observe dilated heart chambers and subendocardial hemorrhages. Medico-legally, oleander is significant in cases of suicidal and homicidal poisoning, as well as cattle poisoning. It's also used as an abortifacient and is detectable even in burnt remains. Quinine, derived from the bark of the cinchona tree, has a long history. The active principles are quinine and related alkaloids. Quinine interferes with muscle contraction, particularly affecting the heart and skeletal muscles. The symptoms and signs of quinine poisoning include nausea, vomiting, diarrhea, headache, dizziness, and cardiac arrhythmias. The fatal dose can vary greatly based on individual susceptibility. Management and treatment involve gastric lavage and the use of activated charcoal. Symptomatic treatment for arrhythmias and maintaining electrolyte balance is also essential. Autopsy features might show congestion in various organs and signs of cardiac distress. Medico-legally, quinine has been historically significant for treating malaria, but there is also a risk of accidental poisoning from overdose. Clystanthus calinus is a toxic plant used in traditional medicine, and unfortunately, all parts of this plant are poisonous. The active principles include various toxic glycosides, which affect multiple organ systems, including the heart. Symptoms and signs of poisoning by Clystanthus calinus are nausea, vomiting, abdominal pain, dyspnea, and cardiac arrhythmias. The fatal dose can vary and isn't precisely defined. For management and treatment, gastric lavage and activated charcoal are necessary. Supportive care is also vital to manage the symptoms. During an autopsy, one might observe congestion in organs and signs of systemic toxicity. Medico-legally, this plant is significant due to its use in traditional medicine and the potential for accidental or intentional poisoning. By understanding these cardiac poisons, their mechanisms, symptoms, and treatments, medical professionals can better manage cases of poisoning and provide critical care to affected patients.